We're going to hear from the Prime Minister, so let's cross there first.
To be fair. Fair to public sector workers who do so much in the service of our country, but also fair to taxpayers who ultimately fund our public services. And the best way we found of making fair decisions about public sector pay are the independent pay review bodies. They were called for by the unions themselves, and for over 4 decades, they have been the independent arbiters of what is fair and responsible. Those bodies have considered a range of evidence about where to set this year's pay, and their recommendations to government are for public sector pay rises to go up by a significant amount. Now, clearly, this will cost all of you, as taxpayers, more than we had budgeted for. That's why the decision has been difficult and why it has taken time to decide the right course of action. I can confirm today that we are accepting the headline recommendations of the pay review bodies in full. But we will not fund them by borrowing more or increasing your taxes. It would not be right to increase taxes on everyone to pay some people more, particularly when household budgets are so tight. Neither would it be right to pay for them by higher borrowing, because higher borrowing simply makes inflation worse. Instead, because we only have a fixed pot of money to spend from, that means government departments have had to find savings and efficiencies elsewhere in order to prioritise paying public sector workers more. Now, there's a clear message here. There are always choices. Budgets are not infinite. When some ask for higher pay, that will always create pressures elsewhere, costs, which must ultimately be borne by the taxpayer or by spending less on our other priorities. So that's our decision. And having honoured the independent pay review process, I urge all union leaders to accept these pay offers and call off their strikes. Already, earlier this year, the NHS Staff Council, representing over half a dozen unions and over 1 million NHS workers, made a significant decision and voted to accept our pay offer and suspend strikes. I'm grateful to them and their members. And today, in response to the news of our decision, I'm pleased to say we've had another major breakthrough. All teaching unions have just announced that they're suspending all planned strikes immediately. Teachers will return to the classroom. Disruption to our children's education will end. And the unions have themselves confirmed that this pay offer is properly funded. And so they're recommending to their members an end to the entire dispute. So it is now clear, momentum across our public services is shifting. The vast majority who just want to get on with their life's calling of serving others are now returning to work. And in that spirit, I want to address those yet to do so. Now that we've honoured the independent pay recommendations, I implore you, do the right thing and know when to say yes. In particular, for doctors and consultants, I would say this. We have a national mission for all of us to make the NHS strong again. The government has not only made today's decision on pay, we've backed the NHS with record funding, delivered the first ever fully funded long-term workforce plan, and met the BMA's #1 ask of government with a pensions tax cut worth £1 billion. So we should all ask ourselves, whether union leaders or indeed political leaders, how can it be right to continue disruptive industrial action? Not least because these strikes lead to tens of thousands of appointments being cancelled every single day, and waiting lists going up, not down. So, today's offer is final. There will be no more talks on pay. We will not negotiate again on this year's settlements, and no amount of strikes will change our decision. Instead, the settlement we've reached today gives us a fair way to end the strikes, a fair deal for workers and a fair deal for the British taxpayer. Thank you. We'll take some questions from the media. Can I start with the BBC, please?
Thank you, Prime Minister. Chris Mason, BBC News. Will you acknowledge explicitly that a consequence of your decision will mean cuts in the budgets of some key public services? And explicitly on schools, given what you've just said about schools, where is the money coming from to pay for that? Thank you.
Thanks, Chris. So, as I said in my speech, this is a significant pay award. It's one of the most significant we've had in decades, and it is costing billions of pounds more than the government had budgeted for, and that has consequences. If we're going to prioritise paying public sector workers more, that money has to come from somewhere else, because I'm not prepared to put up people's taxes, and I don't think it would be responsible or right to borrow more, because that will just make inflation worse. So what we have done are two things to find this money. The first is we're going to increase the charges that we have for migrants who are coming to this country when they apply for visas, and indeed something called the Immigration Health Surcharge, which is the levy that they pay to access the NHS. So all of those fees are going to go up, and that will raise over £1 billion. So across the board, visa application fees are going to go up significantly, and similarly for the Immigration Health Surcharge. For migrants who are coming to this country legally, they have to pay a fee to access the NHS, to contribute to NHS care. I think that's entirely right. Neither of these fees have been increased recently, and we think it's appropriate, given the costs for everything have gone up, that those fees, both for applying for visas and for accessing the NHS, go up too. That will raise over £1 billion, as I said, so it's a significant contribution to helping us pay for these pay awards. But also, we are reprioritising. So we are asking governments, departments to reprioritise to support public sector workers, and that will mean in other areas we will be, it's not about cuts, it's just about focusing on public sector workers' pay rather than other things. And I'm really pleased that the teaching unions specifically have said that they believe this pay offer is properly funded. We put more money into the teaching budget when I first became Prime Minister, £2 billion a year, and there will be more money going into the schools budget to help schools pay for these new pay awards. So they will not have to make cuts, and that was something that was rightly important to the unions, and we have worked with them to ensure that the funding is there for schools so that no cuts will need to be made. The pay offer is properly funded, and that's the basis on which the unions have called off their action, and I'm grateful to them and their members for that. Perfect. Next, can I go to the ITV?
Prime Minister, NHS leaders say there is no chance of them being able to reduce backlogs on treatments in the way that you want if they have to make savings. Are they going to have to make savings to fund part of this pay rise? And then separately, the Office for Budget Responsibility today has said that the UK's government debt is much more vulnerable to rising inflation than any other G7 leading country. Part of the reason is because of decisions you took as Chancellor on QE and on issuing index-linked gilts. Do you regret those decisions?
So on your second question, Robert, it's something you and I discussed a lot when I was Chancellor. Actually, you'll know we have one of the longest durations of government borrowing out of any G7 country and have consistently reduced the amount of inflation-linked debt over years. That's been a downward trend. It's something that I pointed out as a risk to the public finances when I was Chancellor. And that's why I talked then about the risk to the country's public finances and economic security from rising inflation and interest rates. That's why my first priority is to halve inflation, because that is not only good for families' budgets, eases cost of living pressures, it will over time bring down interest rates, which is also good for government borrowing and the strength of the public finances. So you're right to highlight the risks of inflation and interest rates on the public finances. I highlighted the same risk as Chancellor, and that's why an important part of today's decision is, yes, we are accepting the recommendations of the pay review bodies, but we're doing so without borrowing more, because I don't think that would be responsible for all the reasons you outlined, and without taxing people more. Now, with regard to the backlogs in the NHS, look, I agree. Industrial action, strikes, make it far harder for us to cut the backlogs. Right? We've already had 500,000 people's outpatient appointments cancelled and disrupted by the strike action that we've seen to date. It's an enormous number. And in spite of that, though, because of all the other things we're doing, with the funding we're putting into the NHS, thanks to lots of people's hard work and creativity, we are making progress. So last year we eliminated practically the number of people waiting 2 years for treatment. This spring, that we're practically eliminating the number of people waiting 1.5 years, and that's come down to just a few thousand now from over 100,000 at its peak. And we have plans in place to continue working on backlogs. But without the industrial action ending, of course, that will be more difficult. And that's why I would urge consultants and junior doctors to accept the recommendations of the independent pay review body. This is not even the government. This is the independent pay review body who has made a recommendation on their pay, which we have accepted in full, on top of all the other things we've done for the NHS, like the long-term workforce plan just the other week, something that has been called for decades, we have delivered. I would urge them to accept this offer from the independent bodies, and that way we can all work collectively together to bring the backlogs down. I know that that's what the vast majority of them want to see happen. That's what I want to see happen, and I'm prepared to work with them to do that.
But will the NHS have to make savings?
As I said, one of the ways that we're raising money to pay for this is through the immigration health surcharge. That is money that goes to the NHS. So when people emigrate to this country, they have to pay something called the immigration health surcharge to contribute to the cost of the NHS, and the cost of that will go up as part of this announcement in order to raise more money for the NHS to help pay for some of these costs. And could I go next to Talk Radio?
Hello, Peter Cardwell, Talk Radio. Are you slightly hiding behind the independent pay review bodies here? The junior doctors are getting less than 1/5 of the percentage point rise that you're asking. How do you honestly expect us, and expect them to believe that this is a fair offer when they're asking for so much more? And won't strikes be inevitable now in the autumn?
This is a process. The independent pay review bodies are a process that has existed for a very long time. Indeed, it's an institution and a set of institutions that the unions themselves called for, and for a long time it's been accepted as the best fair way that we have in this country to find resolution on public sector pay. Now, there are representatives of unions, of government, of economists on the boards of these public sector pay review bodies. They make independent recommendations to the government, and they do so in a range of sectors. And that's what we've accepted. Right? That's what we've accepted, and we've accepted their headline recommendations in full. For junior doctors in particular, I'd say like a typical junior doctor on pay point 3 is going to receive a significant pay increase, around 9%, as a result of us accepting the PRB's recommendation. I think most people think that is a significant pay increase. For a typical junior doctor, 9%. That is the pay increase that is being delivered as a result of our decision today. And that comes along all the other things that we've done for the NHS. Record funding, a long-term workforce plan fully funded so that there are more doctors, more nurses, more of every type of healthcare worker in the NHS for the first ever time. Funded expansion of training places that everyone has called for. And as those junior doctors progress to become consultants and are paid even more, they will benefit from the significant tax cut that the Chancellor announced in the spring budget, which was the BMA's #1 ask of government. Was that pensions tax cut? We've delivered it, and those junior doctors, as their careers progress, will benefit from that. So look, taken together, I think we've done the fair thing. And I would urge the junior doctors and consultants to see that, to see the commitment that we have to the NHS, to recognise the economic context that we're in, and accept the recommendations of the independent pay review body, a process that is long established, is independent of government. We've done what I believe to be the right and responsible thing, and I would urge them to do the same thing too. Can I go to the Daily Mail?
Harriet Line, Daily Mail. How do you expect to bring down inflation to 5% when you're giving public sector workers a pay rise of in excess of 6%? And secondly, you said earlier this week that you didn't know who the BBC presenter facing serious allegations was. Were you shocked when you heard the news yesterday?
On your first point, Harriet, if you look at current pay settlements across different ranges, lots of different estimates and forecasts for what pay settlements in the private sector are averaging at the moment and are forecast to be. So whether you look at ONS data that was out the other day, Bank of England, Treasury has a panel that they use, expert HR survey data as well. All of that points to private sector pay settlements in the kind of 5 to 7% range now and over the course of the year. And I think the vast majority of these PRB recommendations fit within that type of range. So they are broadly, obviously it's going to vary for each individual person depending on what grade they're in, but broadly in aggregate, the pay settlements from the PRBs are in line with what we're seeing in the private sector. That's the first thing to say. I think the second thing I'd say is, is it inflationary, is it not inflationary? It's not going to be inflationary because we're not borrowing to fund it. And I think, and I've been very clear about this, everyone can see the economic context we're in. I'm determined to bring inflation down, and government has a responsibility not to excessively borrow money. If we do that, we just will make the situation worse and make it last longer. I'm not going to do that, which is why we have had to make some other decisions elsewhere on visa fees, immigration health surcharge, reprioritisation to pay for these pay settlements, because that's what being government means. It's about prioritising, it's about making choices, doing the difficult and responsible things. That's what we've done, but I am determined to bring inflation down, and this is one of the things that will help us do that because we have not borrowed to fund these pay increases. Next, could I go to the Telegraph?
Hi, Ben Riley-Smith, The Telegraph. Can I just drill into where the money's coming from? Because it's not coming from borrowing. About £1 billion's coming from these visa fees. That leaves a couple of billion, I think, that needs to be found from reprioritisation. Can you name a single thing that's going to be squeezed to get the money through reprioritisation?
Yeah, it's not one big thing, Ben. It will be a range of things. So the Chancellor and I and the Chief Secretary have engaged in an exercise with departments for a while. And I think many of you are asking, when are we going to see this decision on pay? When are we going to see it? It's because we've been taking the time to go through everyone's budgets to make sure that there are areas that where we can find reprioritisations from, where we're maybe not spending as much as we had anticipated, that we can shift over to public sector pay without impacting frontline service delivery, because that was very important to us. It was also important to the schools unions, and that's why they are confident that there is extra money going into the schools budget to make sure that these pay offers are fully funded. So it's not one big thing, it's just painstaking work of going through every department's budget line by line, finding every little bit of saving or where we're not quite spending as much as we thought, where we can shift that to public sector pay to make sure our workers are rewarded and that we honour the recommendations of the pay review bodies. But what I would say is that does mean choices, right? And I'm not shying away from that because I think that's the right thing to do. But because we're raising money through fees and the immigration health surcharge, that contributes significantly and will ease some of that pressure. The Guardian, I think, lastly. We've got time. Yes.
Hi, Pippa Carrera from The Guardian. You talk about reprioritisation of what sounds like it's going to be about £2 billion worth of money. Can you guarantee that decision won't mean more frontline cuts? Let's just call a spade a spade. And secondly, can I just ask you if you can give us a status update on Liz Truss's resignation peerages? Are we likely to see them over the summer?
On the previous question, it's the same thing. We have protected frontline services. So I think the teaching unions would not have supported this offer if they didn't believe that there was money coming into the core schools budget to help pay for these significant pay awards. So we've worked through the detail of that with them specifically to make sure that they are comfortable in how we're doing this. And as you can see, I very much welcome the engagement we've had with them, the constructive way that they've approached those conversations, and indeed their announcement today, which I think is enormously wonderful news for our children. It's important that we get them back into the classrooms and catching up on what they lost out on COVID. So I'm delighted with today's news. And more broadly, whether it's NHS or everywhere, we've funded the frontline services actually very generously, and we're now need to deliver on improving, as I said, people's waiting times for electives and all the rest of it. I haven't got an update for you on residential honours. They haven't come to me yet. And as I think you know, I tend to just follow the due process on these things. And I also, someone had a question before about the BBC. Look, I wasn't, sorry, I just forgot, I wasn't ignoring your question, but I would say, look, I think for all the reasons that everyone is aware of, this is an incredibly sensitive matter. And what I'd say is that the BBC is going through its process of fact-finding and establishing what's happened. The right thing is for them to get on with that, and for us to give them the space to do that and recognise the sensitivity of this for all involved. And there's nothing more than that I can or should say, I think, at this point. Good. I think that's it. We've got one time. Last one. Yeah. Times.
You're standing up in front of a pledge to halve inflation, but minister after minister has refused to say what that means, what the actual target will be. Is it 5%, 5.35%, 5.5%. Can you today level with people and just say exactly what that target is so we know what metric to judge you by?
I think that everyone can see what inflation was when I made that announcement in, well, I made the announcement in January and we had the numbers, I think, for December last year. But look, do I think that everyone sitting at home is focusing on whether inflation goes down to 5.2, 5.4, 5.3? No, I don't. Actually, what I think they want to know is that the government is committed to easing the burden on their cost of living. And that is my priority, and halving inflation is the most important step we have to doing that. And I want to do that over the course of this year. Clearly, that's become more challenging. Everyone can see that in the numbers. But that doesn't mean it wasn't the right thing to say. You know, I am ambitious for our country. When I set those targets or priorities, lots of people said, well, that's all going to be too easy. You said all these things that you're going to easily meet. That was what people said. I didn't believe that. I thought it would be tough. But I thought it was the right thing to do because that's the way that we can bring maximum benefit to people's families up and down the country. And we're going to absolutely stick to the course. That's why today's decision is important. As I said, it wouldn't have been right to accept these pay offers and then fund them with borrowing. That would have been the easy thing for me to do. Wouldn't have involved me having to put fees up everywhere else on visa fees or immigration health surcharge. Wouldn't have involved, you know, detailed work trying to find savings and reprioritisation from elsewhere. It would have been easy, but it would have been wrong. It wouldn't have been the responsible thing to do for the country because I'm determined to bring inflation down and I'm confident that we will do so. And halving inflation is just a staging post because inflation belongs back where it should be at 2%, right? So, you know, this is a journey to get it down there, but that was the first step on the journey. But people should be left in no doubt about my resolve to deliver on it. Perfect. Thank you very much for your time.
So the Prime Minister, Rishi Sunak, there confirming that the government has accepted the headline recommendations of the independent pay review bodies, which have been looking into public sector pay. It means that police officers, for example, their wages will go up by about 7% on average this year, teachers 6.5%, and around 6% for NHS workers. He said, though, that the money would not be funded by borrowing or by increasing taxes. He said higher borrowing would make inflation worse. And he called on the unions to accept the offers and call off their strikes. He said his message to the unions was do the right thing and know when to say yes. And he laid down the line that there would be no more talks on pay and no amount of strikes would change that decision. Well, let's bring in our political correspondent, Liz Bates, now. So, Liz, a big announcement on the pay of public sector workers. I guess the question now is how unions and workers will react.
Absolutely, and I think what you're seeing from the Prime Minister today, look, these are negotiations and disputes that have been ongoing for many months across lots of different sectors, and he has put himself right at the centre of this announcement today that the government has accepted the recommendations of the independent pay review bodies, and also said quite starkly to the unions, no more negotiations. This is the final offer. You can take it or leave it, basically. And so I think some real brinksmanship, if you like, there from Rishi Sunak. Now, we can already see from a statement that we've had from the teaching unions alongside the Prime Minister and the Education Secretary that they want to recommend this offer to their workers and bring the strikes to an end. And so clearly it's been successful, certainly in that area, and we'll see what the outcome of that is going forward and what workers say. But I think now we're looking to the other unions because, of course, the gamble that the Prime Minister has taken today is that what he would like to see is all the unions now look at this pay offer, accept that the government is going to go no further and decide that the time for strikes is over and that they are going to accept it and move forward. But, of course, that also leaves the door open for some of the unions saying, no, we don't accept this pay offer. Some of them may be unhappy with the funding arrangements for it, as you saw the Prime Minister just outlining some of that there. And they could say, we will carry on with strikes. And of course, that now leaves the Prime Minister in a position where those strikes just go on indefinitely because he's given himself no wiggle room with any further negotiations. That could be incredibly damaging over the next year and a half as we come to a general election.
And interesting to how these pay rises will be funded. He said they're paying a lot more than they originally anticipated, but they're not going to get the money from borrowing more. He said that would be inflationary, and he doesn't want to put tax taxes up either. So how did he explain how that money would be found?
Well, I was a bit worried when I heard that there was going to be no borrowing, no new taxes, that it was going to be coming from the magic money tree. He did actually outline some of the areas. I think it was visa fees will be going up, the NHS surcharge will be going up. That will raise quite a lot of money and get quite far in terms of funding these pay rises. But look, I think when it comes to the departments, they will have a lot of difficult decisions to make. And you saw Pippa Creer from The Guardian there stand up, and many of the journalists in the room pressed the Prime Minister on that issue. Where is the money coming from? Because what we heard previously, and Rishi Sunak repeated this, is efficiency savings, reprioritisation. Well, we know when we hear those words that what that really means is cuts. And what we hear from workers across lots of different sectors who are in the public sector, I imagine many of those people feel that they cannot make any more frontline cuts, but they will have to fund these pay rises if they're accepted.
Well, yes, it'd be really interesting to see what the unions say about all of that. Liz, for the moment, thanks very much indeed. Well, as you've just heard, the Prime Minister, the Education Secretary, Gillian Keegan, and the General Secretaries of the 4 education unions have all released this joint statement. They've said the 4 education unions will now put this deal to members with a recommendation to accept the School Teachers Review Body recommendation. This deal will allow teachers and school leaders to call off strike action and resume normal relations with the government. So let's talk to one of those union leaders. I can speak now to Mary Bousted, who's Joint General Secretary at the National Education Union. So a very good afternoon to you. So this is big news, obviously affecting lots of different sectors, but tell us how the pay deal that's been offered affects you. What exactly has been offered to teachers and why have you been minded to accept it?
So the pay deal is the review body recommendation of 6.5% pay rise for teachers and leaders, and a 6.5% on any allowances that they might have for extra responsibilities. It's the biggest pay award that the independent review body has ever made. And importantly, we've secured guarantees on how it will be funded, which means that frontline support services in schools will not be affected.
Well, yes, talk me through that funding, because we have heard from the government they're not going to borrow anymore and they're not going to put taxes up. And they've talked about reprioritising within departments. And the fear is that to fund these pay rises, there may have to be cuts somewhere within that department. So you're saying you're getting extra money to make sure that schools won't lose out?
Yes, well, we've received guarantees that the funding will not come from the schools building programme, because school buildings are in a terrible state. It won't come from spending on special educational needs, and that it won't come from post-16 funding or from attained nurseries. So we've received written guarantees that the funding will not affect frontline services in schools. The vast majority of schools will find the pay award affordable, because head teachers will have budgeted for a 3.5% pay rise, because that's what they were advised to do. That's what the government said to the STRB. The pay review body was affordable from the government point of view. So there's an extra 3% which the government will fund from underspends in the department. Now, it's not up to us where the government finds the money from. That's a matter for government. What we've obtained is guarantees that it will not affect frontline services in schools or in colleges.
And you and the other union leaders have said that you'll put this offer now to your members, but you're recommending they accept it. Do you think that they will, given that although, as you say, this is the biggest rise that has been offered before of 6.5%, it's still well below inflation, which is 8.7%?
Well, that will be up to the members, but we will say to the members very clearly that this is an offer that we think they should bank. They should accept this offer, because it is the biggest rise that they've had in years. By their action, my members have taken 8 days of strike action. Those days of strike action have moved the government from an initial offer of 3.5% to 6.5%. That is a significant move. Now, yes, it is still below inflation, but we will continue to campaign for teachers to gradually restore their pay to the levels it was in 2010. We always knew that it was going to be a very tall order to get there in 1 year. What we're saying is this is a good start.
So you wouldn't rule out strike action in future?
Well, as a union, you'd never lose out strike action in future. But what we have said is if members accept this deal and they will have a vote on it, then the dispute we have currently with the government on pay is over for this year and for September's pay award. That is the end of this dispute. Yes. I'm not going to rule out strike action ever again. I mean, I'm sure that's not what you meant by the question.
No, I meant in a year's time, perhaps. So if you were resolved, along with other education unions, to accept this offer, but what do you make of the Prime Minister sending out a message to other unions saying there'll be no more talks on pay and no amount of strikes will change that decision? Do you respect that he says that? Is that a reasonable position from your point of view?
Well, no, I don't think it's ever a reasonable position not to have further talks with unions who. It's very hard to take strike action in this country. The threshold, the rules around strike action are such that the International Labour Organization says that it's the government's not acting according to international labour regulations. So no, I wouldn't say never having any more negotiations is a good move. But I can't talk for the Prime Minister. He's got to make his own announcements. I always think you should negotiate with unions. We have had negotiations with the government. They have agreed to honour the independent pay review body, and we have agreed to put that offer to members and to say to them, this is the best offer you're going to get through negotiation.
And give us an idea of what it's been like for teachers carrying out this strike action, as you say, 8 days of it.
Well, it's been gruelling. It's been remarkable that teachers have stayed the course, that the strikes have stayed strong, and that they have stayed determined. It has been very hard for them. But this is a deal which gives them the best award on pay that they've had in nearly over 2 decades. It gives them, a better place on which to stand in terms of the real value of their pay, although, as you say, it is still below inflation. And it means that, and crucially, the funding for this pay award is not coming out of frontline services for schools. All in all, we are recommending that to our members as the best deal that they can get through negotiation. Of course, it's up to them whether they accept or reject that deal.
OK, well, Mary Bowstead, thank you so much for joining us and giving your very swift reaction to this news. Joint General Secretary at the National Education Union. Thanks very much indeed.
Thank you.
Let's get some more reaction now, shall we? We're going to go live to East London, where we're joined by Roy Lilly, who's a former NHS Trust chairman. A very good afternoon to you, Roy Lilly. Thanks so much for talking to us. I wonder, first of all, what your reaction was overall to the Prime Minister's announcement this afternoon that the government is going to accept the headline recommendations of these independent pay review bodies. He's called it a fair deal for workers and the British taxpayer. Overall, what's your reaction?
Well, Anna, good afternoon. There are two things, really. First of all, it is when he said, do the right thing, know when to say yes, and there will be no more talks. That's a clear message to the BMA, who are obviously going to have to put this offer to their members. And the question is whether or not they'll call off their industrial strike, which had just, of course, started today. The other thing I thought was flagged out by the Chief Secretary of the Treasury, who's speaking in the House, and it was later repeated by the Prime Minister. It said the funds will be raised by the spending review, efficiency and reprioritisation. The Prime Minister then put some flesh on that by adding about the international health surcharge for people coming here and putting that up. But I think the code was in efficiency and reprioritisation. Now, the NHS is already targeted with a 2% prioritisation, and it's already cut its digital budget, the technology budget, and it's also cancelled some scanning technology that it was going to enter into. So one wonders really the extent to which, how much of this 6.5% is going to have to come from what we call the departmental expenditure limit, the DEL, the amount of money that's coming from the Department of Health, and how that will cascade into the day-to-day running of the NHS. So those are the two things. There was a very tough message to the BMA, and I thought there was a kind of a sinister hint to the NHS.
Well, yes, and can I drill down into this word reprioritising a little bit further, because one of the key messages from the Prime Minister was this had to be fair to the taxpayer. He didn't want to increase borrowing because that could increase inflation. That would have an impact on everybody, and he didn't want to put taxes up. So he was saying that the money would be raised by reprioritising within departments. So do you understand that to be, he talks about efficiencies. I mean, what does that look like as far as you're concerned? What does it mean?
Well, the NHS at the moment has only got one priority, and that's to reduce waiting lists. That's the big problem. Now, they've done well on the 2-year waits. They've brought them down to nothing. The 18-month waiting list is down to 90%. The problem they've had, of course, is the strikes. Every time there's a day's strike, it's nearly 100,000 people get bumped off the waiting list and get put back on. So that's been their problem. So their whole priority is around waiting. As far as other priorities are concerned, where there are 5 hospitals that are falling down at the moment, are propped up with scaffold poles, but that's the capital amount of investment that's going into the NHS. Whether or not the Treasury will be prepared to switch capital into revenue, they have done it before, and that might have an impact on the so-called 30 new hospital program, whether or not that will survive. As far as the day-to-day priorities are concerned, it's a very interrelated team-based business, but when you make a cut in one part of it, it cascades through everywhere else. The productivity targets that the NHS has got, as I say, it's a 2% target this year. Effectively, I mean, to be honest, having run a hospital, I can tell you that a lot of these targets can be achieved by how the accounts are written. But I think if the NHS would have to reprioritize, I don't know what it would reprioritize, because simply the total focus of the NHS now is on waiting lists, which of course is one of the Prime Minister's 5 priorities.
And yet the government will also say that it's important that doctors, if they were to accept this offer, that they're happy with their pay. They're worried about retention of doctors and recruitment as well.
Yes, that's an extremely important point. Retention is still not resolved. We have a workforce plan. There were various chapters in the plan. One of them was around retention. I thought it was fairly lightweight, really. It didn't speak to me about a big effort to retain people. We're seeing a lot of young doctors, particularly going to Australia. The Australian government have had a huge recruitment program here, and we're seeing that's getting traction, and doctors are leaving. Whether or not, I think the doctors can expect, I made a note, about a £3,000 a year pay rise. Whether that will be enough to keep some of them here, who knows, and whether or not there'll be enough to end a strike, which is, after all, about pay restoration going back years, and is a total of about 35%. My guess is the BMA will put it to they'll be having talks this afternoon. The big decision for them is, will they call off the strikes now and then put this pay offer to their members? There'll have to be a ballot for their members, and see whether or not they'll accept it. I think coming with the warning from the Prime Minister that says we're not going to do any more talks, I think that strengthens Steve Barclay's hand, and the BMA have got some serious thinking to do about what future strikes would look like, and the extent to which they will be able to continue to get the public support, because public support is a very important part of striking. The nurses went on strike, and public support was solid. The doctors are on strike. Public support has started to wane. Whether or not it will wane further, because the public will say, well, hang on a minute, a £3,000 a year pay rise is not bad. I'm not getting anything like that. Then once the public support starts to erode, it strengthens the government's hand. So I think we're going to go through a very difficult period to see how the BMA handle this.
OK, well, Roy, Lily, really interesting to get your take on today's announcement. Thanks very much indeed for joining us this afternoon. We appreciate it. Well, let's get more reaction now. I can speak to Dal Babu, who's a former Chief Superintendent in the Metropolitan Police now. A very good afternoon to you. Thanks so much for giving such swift reaction to today's announcement. As we've heard, the government is backing the pay review body's recommendations on pay. Correct me if I'm wrong, I've been scribbling notes while the Chief Secretary to the Treasury was making the announcement in the Commons, but what I've got written down here is the police will get a 7% uplift. Is that what you were hearing as well? How do you think that will go down?
Well, the average police officer earns, when they start, earns just over £30,000. So we need to put that 7% in conjunction with that low starting salary. We also have to remember, unlike all the other people that you've interviewed today, teachers and medical staff that do a wonderful job, the police can't strike. So basically, what we've ended up is this is a final offer to the police. So there is a real challenge. And effectively, the offer doesn't go to the inflation level. So in effect, it will be a police cut. It'll be a real cut in wages. So I think that the challenge we have is that I understand we have some real challenges in the economy, but in terms of policing, it will make it extremely difficult to recruit and indeed retain people. And what we have to remember after austerity, we have a very inexperienced police service. Almost a quarter of all the new frontline officers have less than 5 years service. So there's some real challenges, and whether it will be enough to make people want to join the organisation and stay remains to be seen.
Well, yes, and as you say, police can't go on strike, so it's harder perhaps to assess the mood amongst workers than we can in some sectors which are choosing to withdraw their labour. What would you say the mood was amongst police and amongst their levels of pay, about their levels of pay?
Well, police are very, very disappointed because over the years, it's not just this payoff on the face of it seems generous, but it's not at inflation level. But we've had several years where police officers have had no rise. And so, in effect, with inflation going up, they've effectively had a pay cut. The pension conditions are also less. And I feel incredibly embarrassed sitting here because my pension went up by 10%, and yet the offer that's being given to people who are doing the hard work and grafting, the police officers working early, late and nights, are getting 7%. So it does seem fundamentally unfair. So I think there will be a lot of concern about this offer, but because police can't go on strike, they're limited to what they can do.
And obviously, it's going to cost the government a lot of money to meet these increases in pay, but they say they don't want to borrow any more money or put up taxes because they want to be fair to the taxpayer as well, and they've got an eye on inflation. They're talking about reprioritising within departments. How do you interpret that, and what do you think that could mean for the police?
Well, I think the police have been cut to the bone, and so I think the fact that we've had 20,000 reduction in police officers, which are now being replaced, but we've also had 18,500 police staff that aren't being replaced. So in terms of efficiencies, I'm struggling to see where those efficiencies would be. I think the other thing we have to take on board, and it was interesting just hearing about the sympathy that there is for nurses. I don't think there's a great deal of sympathy with the police. So I think with all the scandals that we've had recently in policing across the country, there isn't a great deal of sympathy with the police. So we just need to make sure that the police get this right. In terms of getting that figure changed, I think it's going to be highly unlikely. I think the police will accept that this is the offer that they're going to get. But we have to really look at what we can do in the long term to make sure that people join the police and that we don't have this yo-yo effect of where whenever crime goes down, we start cutting the numbers, which is effectively what's happened here.
Well, yes, and talk to us a little bit more about that. How much of a challenge is it to recruit at the moment, and how much do you think pay is part of that, given that, as you allude to, levels of trust amongst the public are low?
Yeah, absolutely. So when you look at the nurses going on strike, that level of trust and confidence in the nurses remained high. But I'm afraid in policing, trust, there's an old Dutch saying that trust walks towards you and disappears on the back of a horseback. And I think given all the scandals and the Louise Casey report that we've had looking in police and the issues around racism, misogyny, homophobia, there is limited sympathy for the police. And I think that will contribute if the police then sort of go back to the Home Office and ask for more money. So I think we are where we are. I think the recruitment problem will continue because police officers, when they come to retire, do retire. They don't stay on. And in the old days, people used to stay on. The other thing I've noticed with policing is that people will join the police and do relatively few years. Certainly when I joined, most people I joined with did their 30-year service. I think the new band of police officers don't necessarily see it as a full career. I think the pension has also changed quite significantly. I think police pensions were notorious for being incredibly generous. That has all gone. I don't think there's going to be a great deal of sympathy with police officers who talk about the conditions around pensions not being as generous as they are. So the police are perhaps not in a strong bargaining position as perhaps teachers and nurses and medical staff are.
Well, Del Babu, we appreciate your time. Thanks so much for giving us your reaction to today's announcement. Former Chief Superintendent in the Metropolitan Police, Del Babu, thank you.